All right. Hello and good morning, everyone. Welcome to today's webinar on overtime and proper rest, knowing what's enough. My name is Mackenzie Keller with the CST Pool, and I am joined by Kyle Brown, our senior risk consultant. Today's webinar will teach you how to identify and manage situations where employees may be asked to work too much overtime, understand how excessive overtime impacts employee performance and safety, and how to implement steps that can be taken to ensure that your employees are taken care of. If you have any questions throughout the webinar, you can put them in the chat so our presenter can see them, and we will also have time for you to ask questions at the end. Also, this webinar is being recorded and will be distributed sometime later today, so if you have to step away for whatever reason, you're more than welcome. We'll be here when you get back, and you can watch the recording later to see any parts you missed. With that out of the way, Kyle, I'll turn it over to you.
Good morning, everyone, and thank you so much for the introduction, Mackenzie. As she was saying, today we're going to be talking about overtime, mandatory overtime, emergency overtime, basically anything that's going to require us or our teams to spend more time than they typically would on the job and what kind of effects those may have. Personally, I think that this is a very timely webinar considering the daylight savings time just took place on Sunday, and I don't know about all of you, but it is definitely something that I am feeling. And it seems like a lot of the folks that I've been talking to this week are feeling the same way. So it's not always just work. Some things I want to throw in here as tidbits as we go through. Sometimes our personal lives can impact our proper rest or things like daylight savings time. So it's a lot of we're going to be talking a lot about the impacts and then basic little checks that we can do as districts to keep those at a minimum. Now, I do want to give the caveat that some of these solutions are not going to be applicable for everyone. Also, some may work better than others, but I think one of the key takeaways here is I think in most of our industries, and we can all agree with this, overtime, emergency overtime is pretty unavoidable, but it's how do we manage that in the best possible way so that we're protecting our district and we're protecting our team. With that, we are going to go ahead and move on. Hit the wrong button, my apologies. So our real goals today are going to be understanding fatigue as a risk factor when we talk about mandatory overtime. We all get tired. It's something very normal in life. So, as we go through some of these risk factors or feeling tired or feeling overworked, I just want you guys to put yourselves in your own shoes and think back to past experiences. When have I been overtired? And looking back at it with the power of retrospection, how has that negatively impacted me? Or what's something that I done maybe that I couldn't have? And then we're going to look into some of the negative factors, such as legal and operational implications. So, based on what happens with being tired, injuries, equipment damage, we're really going to go into that and what it can do to the district and why it's important that we're addressing this. Then we're going to talk about our impacts on the employee and the public as a general. Next, we're going to talk about managing overtime responsibly. As I previously mentioned, not everything is going to apply to every district, but there are some best practices, personal stories from myself, people that I've known throughout the years who have really dealt with this. Next, we're going to talk about building a culture of rest and readiness. Because again, it's really important that we manage our overtime and we're not overworking our teams, but at the same time, your personal life, your own sleep schedule at home has a big impact on that. And we're going to discuss that a little bit as well. Moving on, it's the big why. I think everything that we talk about in any realm, we want to sell a why. Why are you listening to me ramble on a webinar this morning? It's because I'm sure that you who are attending this, you see the potential for negative or adverse effects from too much overtime, too many emergency calls, things like that, and you want some guidance. So, why are we talking about this today? Well, first off, public employees, our special district employees, they often perform safety critical work. And when we say safety critical work, these are jobs that, if not performed in a certain way, could definitely lead to adverse happenings. So, if we use an example of an employee going inside a confined space, And a confined space is an area where you go inside and it could potentially have toxic gases or other things that can hurt you. If they don't follow district procedures because they're too tired, that could definitely have an adverse effect and lead to an injury. Next, fatigue increases injury and liability exposure. Basically, a more tired person is more likely to get injured. Next, moving on, is vehicle incidents are strongly related to fatigue. So again, this is where we're not just thinking about the work that's done, but you got to think once somebody who's gone to an emergency call at the district, what's their hours look like for the drive home? Because that's also a risk factor that you have to consider. Um, According to the National Safety Council, here are some really crazy stats that I found regarding driving while being tired. So, if you've been awake for 17 to 19 hours, according to their study, it equates somewhere around the realm of a 0.05 blood alcohol level. So, you're not over the legal limit driving, but it's almost like driving after a drink or two. And we can all, I'm sure, relate what that does to your ability, your impairment, your reaction time. I've actually got some more statistics on that, so we'll wait for that in a second. But here's where it gets really crazy. If your awake time while driving is increased from that 17 to 19 to 20, your blood alcohol level equivalent jumps up to around 0.08, which is the legal limit. So if you had had that much alcohol, you would essentially have to face the consequences. So, driving after you've been awake for 20 hours is putting you in that same realm. And it's just showing that it does lead to a much higher level of accidents. And critical infrastructure needs immediate response. So, this is another big reason why. It would be very nice to say, wow, we really should never have anybody out more than their typical 8 hours, and we're never going to do that. But unfortunately, we don't live in that world. Whenever you have a water line break, if you're a water and sanitation district, you need to respond immediately because people want water. We don't want to flood the roads. Same thing with our fire districts. You can't say, well, I've already worked 8 hours. I'm not going to go respond to that emergency medical call. It's something that you have to do. So, what we do in the best way we can is just management it as much as possible. Moving on. Here are just some fun sleep facts. So most adults, they require 7 to 9 hours nightly of sleep. That is our best range. I've always grown up hearing that it's 8, so the 7 to 9 makes sense as long as we're in that realm there. That's ideal. Something I want you all to think about, and this isn't even thinking about work per se. This could also be our personal life. Sleep debt accumulates very quickly. Let's say out of a 7 day period, you have 3 days due to maybe there's a good movie that you went to go watch. Maybe one of them is work related, whatever it may be. But let's just say 3 nights out of the week, you got 2 hours less sleep. So your average is 8, you got 6 hours for 2 nights or for 3 nights. And if you think about that math, you multiply that, that's 6 hours. So that means over the course of the week, just missing 2 hours for 3 nights a week, you've almost lost a full night's sleep. And that is a great example of just how our sleep debt quickly accumulates. Next is our circadian rhythm impacts our alertness. So going back to my stats earlier, whenever we were talking about the equivalence of lack of sleep to blood alcohol level, if we go back to that 17 to 19 hour span of being awake, that same study also showed that it can reduce your reactiveness level or your readiness to react by up to 50%. So, thinking about that, it makes sense why there's more injuries and there's more accidents because if our reaction speed is reduced by 50%, think of the things that you're even going to be doing right after this meeting. If you're just walking down the hallway and there's a cord across the ground and your reaction time is 50% slower, you're much more likely to trip on that, let alone getting behind a vehicle. Moving forward, night work disrupts our natural recovery cycles. There is a study by the Medical News that said our night shift workers or people who worked late shifts regularly are at a 40% increased risk of developing heart disease over the course of their lifetime. And here's another important one. Recovery sleep is not fully restorative because let's think back to our 6 hour deficit. Let's say that you have your 6 hour deficit Monday through Friday, and you're like, well, I'm just going to sleep in on Saturday. And let's just say you even sleep for 10 or 11 hours. That doesn't mean that you've caught completely up because the first 8 hours are still just for your Friday sleep schedule. And if you even sleep 12 hours, you have made up 4 of those 6 hours. So again, it's really hard to actually recover. So it's important to keep those sleep numbers up by night as much as we possibly can. So going back to the workplace, what are our exposures of fatigue? I'm sorry. So increased workplace injury rates. Of course, spending more time is obviously going to increase our exposure, therefore more injuries. It's also going to lead to a higher vehicle crash probability. We have a lot of vehicle facts here. According to the National Safety Council, 1 in 25 at some point in their life have fallen asleep behind the wheel. That is a very scary statistics because if you think about that driving on the road, there's possibly somebody who you've been driving around who has not been fully awake and aware. More equipment damage, more increased incidents, and an increase in near misses. We've done quite a few webinars on near misses, but just for our clarification, I think it's important noting what a near miss is. Basically, a near miss is something I was working and I almost got injured. I almost broke a piece of equipment. It's the almost. But what's important to know about near misses is there's a direct correlation between near misses and the number of incidents. So for every 300 near misses, you're going to have 30 minor incidents and you're going to have one major incident. So with an increased number of near miss frequency, we're obviously going to have an increased number in actual injuries and equipment breakdowns. So here's another interesting fact that came from the National Safety Council. Based on just statistics of workplaces around the country, for your injuries, for your equipment damages, employees who are working in the evenings, they have a 15% higher chance of being involved in one of those injuries or equipment damages than somebody who works a normal day shift. And if you take that to somebody who's working all night or regularly throughout the nighttime hours, that jumps up to 28%. So definitely something that we want to be taking seriously. And I do understand that it's unavoidable, so we just need to put things in place to help protect our team. Greater workers' compensation claims, this kind of goes back to the near miss idea. If we're having more near misses, we're having more claims. And the more claims we have, the more likely that one of them is going to have a huge impact. Lastly, is a negative impact on the safety culture. And this really just comes to the way that people think. If you're constantly working forced overtime, you want to be home with your family, you're tired, you're exhausted, you're going to get grumpy, and you're going to start taking shortcuts. It's just the way human nature is, and we know sometimes it's unavoidable, but it's something that's going to happen with your team if they are forced to work a lot of overtime. So that's something that needs to be combated and let them know that their safety is a priority to you. You care about what they're talking about, but and we're working on a solution. I think that's one of the important things too, because some people they have an issue with the mandatory overtime, and some districts not really as much. So what are our roles that are a higher risk for this fatigue due to the mandatory overtime or just the work schedule in general? Of course, we're going to have our fire and emergency response personnel. I think one of the big reasons for this is I feel like a lot of our districts, most of the time, they can get by with your standard daylight workday. But as with fire and emergency response, somebody needs to be available 24/7. So that's where you get in the interesting shifts where they spend entire days at the station. And with that being said, they're not sleeping in the normal bed. They are subject to wake up at a moment's notice, even if it is 3 a.m. But there are things that districts do to help combat this. such as giving them plenty of days off between shifts. They make their bunkhouses where they stay when they're on shift as comfortable as possible. I've even seen districts, and in the sleeping quarters, they will put in red lights because whenever you get up in the middle of the night, a red light is supposed to be less disruptive to your sleep patterns than a normal yellow or white colored light. Next, we have our utility and water treatment operators. Theirs is not as scheduled as our fire, but it does happen a lot. I think especially during this time of year and in the fall, where you get those freeze-thaw cycles that cause a lot of lines to break and rupture. And that's another one of those things. If you have a line break at 2 in the morning, that line still needs to be fixed. So what happens in many water treatment facilities is they will have people on call, and during a set amount of time, if it's your scheduled time to be on call, you have to go respond to that. Public works and heavy equipment operators, what I'm thinking of here mainly is I know we have a lot of districts, especially in our mountain areas, and they have snowplow drivers, so they will actually plow the roads. And if a snowstorm hits in the middle of the night, you have to go plow that road during the middle of the night. And honestly, it's hazardous because not only are you going to be throwing in somebody who's potentially tired because they're plowing all day and into the night, but you're throwing adverse weather conditions on there as well. Next, we have park and maintenance seasonal crews. A lot of time, our parks, they run full capacity all day long during the summer season or whenever their peak may be. And they often have to have people come work night shift because that's simply the only time that you can have folks come in and do those things. And then we have administrative staff during high demand periods. There's two examples I want to give for this. One kind of going back to our parks and maintenance folks. We have plenty of districts who literally go from, we'll say they more than 10 times their employee load during the summer just to meet with the demand. So what does that do for your HR staff who has to process paperwork? What does that do for the hiring process for the managers who have to train all of them? They're obviously going to be putting in more time, and the time they're putting in is going to be much more stressful because they are spending a great deal of time doing more than what they're doing 90% of the rest of the year. Moving on. So we've talked about some of the risk factors and why it's important to be cognitive of our overtime or the time that we're spending doing a job or an emergency call. But when does it actually become a risk? Just according to some statistics. So extends whenever it really becomes a major risk whenever hours extend beyond 12 hours per workday. I don't have any exact numbers what happens beyond 12, but if an employee works a 10-hour shift over an 8-hour shift, there is a 13% higher risk to injury or some kind of equipment damage. And if you bump that up to the 12-hour shift, that jumps up to a 28% higher risk as well. What this really equates to is anybody working more than 50 to 60 hours per week is at a higher risk due to fatigue just because there are only so many hours in the day and we still have to go home. We have to eat. We have to get ready for our next day. So if we're working a 14-hour shift, that doesn't give them a lot of time for the rest of their lives. Consecutive work days without recovery. This would be, I have to work a 17-hour day today because we had a line break. And then I have to work another 17-hour day the following day because we had another line break. This is something that does happen and it can be very detrimental to sleep patterns and just general focus. One thing I will say to this is the fire, in order to do this, most fire districts, they work on a 48-96 schedule, meaning that they work 48 consecutive hours and then they have 4 days off. While there are still scrutinies to this process, and I believe that there are different fire districts across the country doing something that they think will be better for firefighters, this is better than them being on call 24 hours a day, 7 days a week. So there are steps being taken in place, and that's something I want to say too. A lot of the sleep science and overtime science, it's something that's constantly evolving. So another thing that's a risk is mandatory or last minute scheduling. This would be, I don't think we see it so much in our districts, but somebody called off and I need you to take over their shift. I think this could be especially possible in fire. If somebody's not showing up for the next shift, you might have to stay an extra half a day. And after already working your 48 hours, you can see how that could be very tiring. Back-to-back emergency responses. This is also a major risk. I will say one of the hardest incidents reported since I've been at the pool has been due to back-to-back emergency responses. It was a water district. And basically, I think they had five back-to-back calls, back-to-back calls throughout a night. And I think it was 18 hours total. And due to a number of factors, that ended up leading into a fatality of somebody who was working there. So these definitely do compound to become risk factors. So next, moving on to mandatory overtime. What exactly is mandatory overtime? It's basically whenever your shift or your work hours are extended beyond what they normally should be. This typically happens due to staffing shortages, somebody showing up sick, maybe low staffing, emergencies, whatever it may be, but it's something that you're required to do. If not, you could be penalized or disciplined for it. And why do places typically do that? I already briefly covered this, but typically it has to do with staffing or seasonal requirements, such as plowing roads during a snowstorm or high sick leave. I'm sure during COVID, the folks who were able to work probably had to work more hours if half the team was out. And this could also be a deeper issue, such as issues with recruitment or retention. So, if you have a couple people, if you're part of a four-member team and one of those people leaves, that means that their duties have to be spread amongst three others who also have full plates. And you can see how that could very easily turn into an overtime situation. But at the end of the day, the work does need to be done. So, we just have to be cognizant of the risks. So, what are the risks with mandatory overtime? Of course, we're going to have increased fatigue, and that could be a higher likelihood of injury. Elevated vehicle and equipment risk. Here's another fun study. This one's from the American Automotive Association, which most of us know that as AAA. Funny fact, I actually had to look that up because I've just known it as AAA my whole life. So, according to their study, this is based on how much sleep that you get during a night. If you only get 6 to 7 hours of sleep per night, you're 1.3 times more likely to be involved in a vehicle accident. Now, if you drop that down to 5 to 6% per night, that makes you twice as likely as the average person to be inside a vehicle accident or be involved in a vehicle accident. The fact that I thought was very eye-opening and a little scary. Drivers who have less than 4 hours of sleep while driving on the road are 11 times more likely to be involved in an accident than the average person. And I goes back to a lot of the things we talked about. It's going to decrease your decision-making ability because I don't know about you guys, but whenever I'm tired, the only thing that I can really think about is going to bed. And I think that that's a really important perspective to have with your team whenever they're out there working is how much are they working? What's their mindset going to be like? And we're going to talk about creating a communications channel where your team can feel open to talk to you about those things, because I think that that's one of the most important things we can do when we're talking about preventing injuries and risk during overtime. Of course, we're going to have higher claim severity. We've already really covered what that's going to mean. And it could also lead to increased legal scrutiny after incidents, because if somebody gets really injured, you might have people asking, well, why were they working so long? They shouldn't have been working that long. This is obviously an unacceptable amount of time worked, but so next, we're going to talk about some risk controls of our forced overtime. So what are some things that we can do? And we're going to have a few of these that we're going to go over in different slides, but a lot of them are going to be kind of along the same lines. So we're going to define maximal allowable overtime hours. So as an employee, you should never work more than 50 hours a week. You should never work more than X amount of hours a day. That is something that you can define at your district. And if you have questions about that, please feel free to reach out to your friends at the CSD pool. We have some studies that we can refer you to help you build those best practices. Next, require a supervisor to review if they go beyond those limits. We have a bus district, and this isn't just for overtime, but it's something that's required in general. They have they have iPads, and the drivers they have to go through and they have to answer all these questions. That's really just a cognitive assessment. And if their drivers do not meet or pass that cognitive assessment, they're not allowed to drive the bus that day, or at least for a little while, because the idea is if you can't pass this, there is a lot more hazards when you actually get out on the road. And I think that's a wonderful thing to do because I think we can all agree when somebody's not able to do their job, it's taxing on everybody. It puts us behind. It could allow more people to work overtime. But in the grand scheme of things, it's better to divvy that up than to have a bus driver run off the road with a bus full of people. So I very much kudos to the district for implementing that. Next, we want to track cumulative monthly forced overtime. So if you have a pattern where you have a lot of emergency calls, or maybe you have a lot of people who need to fill in for other folks within the district, whatever it may be, make sure you're tracking those hours. And then as you do, maybe you'll start to see trends. And based on the trends, you can adjust schedules, maybe hire more, whatever it may be. But I think keeping track of the actual hours worked is very important. Next, mandate minimum rest before the next shift. The first job I ever worked at, this was a requirement, and I have had to go through this personally. Um, so what I was required to do if somebody got hurt, I would go to the emergency room, make sure they were taken care of, and just kind of see what happened so that I could go through the reporting process. There was one time the injury took place right at the end of our last shift, so we'll say 10 o'clock at night. I do not think that I left the hospital until about 2 or 3 a.m. And whenever I called my supervisor, they made sure that I knew that I was not allowed to come into work the next day until 11. Now, again, that does put a bind on different things and different functions, but if we're thinking of the grand scheme of things, is it better to lose that 4 hours of productivity during the actual shift or to potentially have somebody involved in a life-altering injury? Next, implement a fatigue self-report protocol. I think this is possibly the most important thing we're going to talk about whenever it comes to managing fatigue within the workplace is we want our teams to feel open. We want them to feel like they can come out and they can talk to us even if it's not work related. Maybe I have a newborn and they kept us up all night, whatever it may be. Make sure that they feel like they can be open because, again, we want to put somebody, if necessary, send them home, put them on a lighter risk job compared to having something happen. And this is very important too when we talk about emergency calls. If you have an emergency call and you're the one on call, but you've just not been sleeping well, let somebody know about that. And because again, it's just much better than potentially having to deal with somebody getting critically injured or damaging something. And encourage those conversations. We're going to talk about that more as we go through. So, when is overtime unavoidable? Especially in the world that we live in with special districts, there are definitely times whenever it's unavoidable. So, some we're going to think about is major storms or disasters. We've already talked about our storm truck operators. A disaster could even be something within a plant. We don't have to think large scale. It could just be a big piece of equipment went down and we have to go in early to get it up as fast as possible. Wildfire deployments, especially for a lot of our fire folks. We need to go out and they have to fight that wildfire pretty much until it's done. So whenever it's really important because they could work 24/7 and still possibly not do all the things that need to be done in a wildfire deployment. But that's where we set the parameters. We know that you're good at your job, you're doing an amazing job, but you should not be working more than X amount of hours a day because that puts you at a higher risk and we care about you. And we want you to be able to fight wildfires for years to come. Water system emergencies. We've talked about busted pipes, broken lines, sewer backups. These are things that are going to require immediate response. Because something else we need to remember when we're talking about this, I'm sure there's some that say, well, we can deal with that during our normal hours. You are in the public eye, and that's really bad if the public doesn't see you coming until the following day. Critical infrastructure failures. This goes back to water lines, whatever it may be, roads not being in good conditions. And then we have public health events. So think about COVID. We all, depending on who was available to work or not, or whatever the situations may be, I'm sure that that put a lot of us into unavoidable overtime. And it's just something that we need to learn and plan from. But whenever I think about each of these listed, I still go back to some of those points I made. Make sure that your team is knows that they should openly communicate with you. What are their concerns? How are they feeling? Boss, I need a few more hours. I'm sorry. That's okay. We'd rather have you at your peak than to send you into something before you're ready. And what are the maximum amount of hours that you can work during a given day? So again, keep these in mind during any emergency scenario, and then have backup teams available if you need to, or talk to other agencies. So next, reducing fatigue during emergency operations. Shorten the operation schedules. Very much like what I was saying before, have a set amount of time that people can work. And something we need to remember too, it's not always just solely based on hours. Depending on what you're doing, if you are a firefighter and you're responding to emergency calls, actually fighting a fire for 4 hours is going to be a lot more taxing than working 10 hours doing a minimal impact operation. So maybe it's not limited to 4 hours. Maybe it's limited to whatever you need it to be based on what it is. Have those formal rehabilitation times. How much time can we go beyond before we can actually go back in? And again, this isn't just the number of hours that you were doing the job, it's how taxing was that operation on the individual. Mandatory rotation planning. This is something that I know that a lot of water and sanitation districts do, is they will pick different people from within the organization. And we'll just say Monday through Wednesday, Kyle, you're going to cover the emergency calls. And Thursday and Friday, Mackenzie is going to pick them up. That way, we know that Kyle's not going to be working potentially every day of the week if it happens. I have more to say about this in a future slide, but it is a good idea to have that planned. Because if we don't have it planned, you might have two people showing up for something where you only need one, and therefore you have two people who are at risk of being fatigued. Use of mutual aid resources. I know our fire and ambulance, they do this quite a bit, especially if they're in a general area. If you've had a very crazy week with a lot of calls and your team's exhausted, make sure you lean on your other fire districts in the area if you can. Colorado also has CoWarn, which is a way to share aid and resources amongst water and sanitation districts as well. Post-incident recovery scheduling. This would basically be you responded to this kind of call or you did this action in overtime. You have to wait X amount of time before you can come back on the job. Very similar to what happened to me, where I had to have that 8 hour period between my shifts. Next are some of the financial impacts of excessive overtime. Increased injury and severity. We've already briefly covered this and why this matters specifically to us. Because the more hours you work, for one, the more amount of time that you're spending at work just increases the exposure there for the injury. And also, the more employees become fatigued, the more likely they are to actually experience an injury or something similar to that, or an equipment malfunction. Lost productivity and presentness. Basically, what we're saying here, the more people work, the more they feel overworked, the less productive they're going to be. And I'm sure that we can all relate to this. How many people in this call are completely useless before you have that first cup of coffee in the morning, that groggy feeling? Unfortunately, the more overtime you work and the more fatigued you become, the harder it is to get that to go away. And with that being said, if you spent all night out on a call and you have to do your day-to-day operations, it's going to be harder to be present because you're still recovering from the night before. Of course, equipment repair and insurance cost. This comes from two different ways for equipment repair. One, equipment, assuming that it's going to be working with the folks who are working overtime. The more you work something, the more likely it is to break. And also, the people operating it are more likely to make small mistakes. the more that they're on something. I'm sure that we can all relate to this as well. Overtime pay and compounding payroll strain, that's kind of an unavoidable thing, but I think we're really mainly concerned at this point about keeping everybody safe and keeping everything running in our district. But I will say a big one is the final point, turnover and recruitment expenses. Just simply, if people have poor work schedules, it's hard to keep morale high. And the lower the morale is, the more likely they are to leave. And that's really a snowball effect because if you have people leaving because they're working too much, well, guess what happens to everybody after that person left? The people have to work even more than they were before, and then you can really turn it into an issue. So I think this is also where communication comes in. Asking those questions. If you know that you're having a period where there's a lot of overtime, there's a lot of hours that they weren't expecting. Hey, how you doing? Do we need to do something with the schedule so you can have more time off? And that does two things. One, it gives them a chance to voice how they really feel so you can know how the program's going. And two, it's going to make them feel valued. And a valued employee, even if it's not the ideal circumstances, they'll know that there's light at the end of the tunnel. You guys are making changes, and it's going to make them want to stay. So definitely multiple points to think about there. So, what are some signs of fatigue? This, these are things I want you guys to all think about the times that you've been tired at work, at home, whatever the situation may be, and check the boxes. Does this apply to you? And then I also want you to think about some of the folks that you've worked around, especially some who maybe are working more hours than expected, and see if any of these kind of catch on. So, slower reaction time, we've already covered that. If you're awake for 17 to 19 hours, your reaction time can be up to 50% slower. Increased minor mistakes. I don't know about you guys, but I really feel this one. Not really from a work perspective, but a personal life perspective. Who started a project that was supposed to take 4 hours, and then you're the 10th hour into your 4 hour project? And me personally, I start to make a lot of minor mistakes because I'm no longer thinking of how do I most effectively do that. I'm like, how do I get this done so I can go to bed? How do I get this done as soon as possible? I have other things to do. That's very much true, even in the work environment. So we have to keep that in mind. And again, it also tracks back to our slower reaction time. If we're reacting slower, the little things we're doing that we could normally catch before, we're not necessarily going to catch in time. Irritability and reduced morale. This kind of goes back to projects that take longer than they should have. Think back to our personal lives. When you're on the 10th hour of that 4 hour project, we're no longer happy and having a good time. I think it could be said a lot for a lot of the projects that we're working on, even if it is at work as well. So, frequent yawning and micro sleeps. This is a way to self-regulate and look at your team as they're working these hours. If somebody's constantly yawning or dazing off into nowhere, or who's ever heard the term, oh, I'm just resting my eyes for a second, those are signs that those people are exhausted, they're overly fatigued, and they need to have something done before it leads to something severe. Lastly, is increased caffeine dependence. I'm sure we've all seen the people, they drink energy drinks or coffee like it's no tomorrow. But it's okay to have caffeine, but it's people who literally absolutely cannot function or it seems like they're drinking an excessive amount. Again, they can do whatever they want to. There's nothing wrong with drinking caffeine, but this is signs to look for on your team. If you have, let's just say, an employee who's worked with you for 10 years, they typically have 2 cups of coffee throughout the day. Not that we're ever tracking coffee consumption, but you notice during this time of really high turnover and seasonal spikes in work, they're now drinking 6 to 7 cups of coffee in the day. Maybe that's just the time to have a quick sit down. Hey, how's everything going? How's the workload? What can we be doing to make this more effective and more sustainable for you? So it's just being observant of what your team's doing and how that dynamic is currently functioning. So next we have some common incident patterns. Excuse me, patterns with working too many hours or fatigue. So vehicle collisions, latent shifts. We've already talked about this. The only thing I'll add to the vehicle collisions is when we're driving late at night too, that is a whole additional set of hazards because then we have headlights, animals are typically more active. So that's also a factor to play into this as well. Equipment errors after long days, whether this just be the equipment overheating because it's not supposed to be used that long, or maybe somebody pressing a wrong button or not properly starting it. Or here's one that I'm sure a lot of us can relate to. Most districts have some kind of vehicles or fleet. Within that, they should be doing pre-shift inspections or checks. But if you're working a 15-hour day just trying to get the job done, are you going to think about doing your equipment checks? Are you going to think about doing that routine maintenance? Not necessarily. That's going to be one of the first things to fall by the wayside, and that's when we're going to start to see the injuries. Next, procedure mistakes. People are going to take shortcuts because they want to be home as soon as they possibly can, or it'll be fine. I just need to get this done. They're going to try to find ways to cut shortcuts just because they want to get it done. Administrative errors in documentation. We're going to go back to that HR department who is hiring 400 people in 2 months and they're working 12 to 13-hour days just to process all the paperwork. They're much more likely to make an error and not pay as much attention to detail. Not saying it's absolutely going to happen, but it is definitely a possibility. And then near misses during seasonal work surge. The harder we're working, the longer we're working, the more likely we are to see the near misses. And I know you guys can't answer this, but what do near misses lead to? More injuries, more close calls, more severe injuries. So that's how that really snowballs there. So one thing I think we should do, and if you listened to any of our webinars in the past, we're big fans of risk assessments, and risk assessment should also be done in the world of overtime. So ask yourselves, what are my risks whenever it comes to overtime? The first thing that we can do by applying this is track overtime hours by department, by individual, by the entire district. The more numbers you have, the better you can look at it. Identify your high frequency roles or high frequency times. This could be during the year, during the month. Um, One thing I think that I forgot to mention when we're talking about administrative overtime, and I think that a lot of us can relate to this, is who here has a lot of extra work leading up to a board meeting? And then the board meetings themselves are typically held in the evening after a long days of work. So that is another way that you could potentially be exposed to the fatigue. And if so, this is specifically talking to our managers in the room. What are you doing to protect yourself after that? Next, review injury data versus shift length and ask yourself, was that person working beyond their normal scope of work? Was there a pattern? How many hours did we have them work over the last month on a week by week basis that led up to this injury? Analyze your near miss reporting trends. It's a great saying for a near miss program. The best way to prevent the next injury is to study the one that never happened. So look where people are reporting near misses and also encourage them because I think that that's a big stigma that we all have to work by as districts, and it's everywhere too, is especially if you're working long hours and you took a shortcut and it caused a near miss. Well, I didn't put on my hard hat and a wrench almost hit me on the head. That's okay. And I think it's developing a relationship with your team where they know they're not going to get in trouble for doing that. You guys are going to come at well, why weren't you wearing your hard hat? And why did that happen? And that's going to lead you to, well, maybe we need to change something internally so our employees don't feel like they have to cut those corners just to get home 10 minutes earlier. And include fatigue hazard assessments. I discussed the district that uses the iPads for their drivers. I'm sure there's similar things that you could do there as well. Maybe it's just even a questionnaire or a conversation, because if you talk to your team, you're going to be able to see little patterns of things that they may be missing. The next page is just a risk assessment chart. Once you have your near misses, once you have your trends, you can start reporting on things. We'll use the board meeting for an example. What's the probability that you're going to have a board meeting? Well, I would say it's probably going to be the occasional to probable. So I would guess most of us have monthly board meetings. And for the severity, let's rate how tired you actually think you're going to feel. Marginally tired or catastrophically tired. So that's whenever we look at this, let's just say we do an occasional board meeting, saying it's once a month. And after a board meeting, you're moderately tired. So that's a two. You multiply those two numbers together and you have a fatigue rating of six, essentially. And then you take it and you look at it and say, well, our rating right now is a six. What can we do to bring that down to a four? What are the steps we could take? But let's go to something a little bit more extreme, such as let's say you're having a really bad year as a water district. There's some really big deep freezes and you keep busting lines. So, what are the chances that a line's going to break this week? We'll say four probable. That means multiple breaks during that week. We'll say three or four. And how tired is our team after that? We're going to rate them at a three critical because it's typically a 6 hour job to fix a line break. So now they have a risk rating of 12, and we can see how much more likely our potential for a hazard is there. So do that with some of your high impact, with some of your reoccurring operations that could cause fatigue. So moving forward, so some administrative controls that we can apply. Cap the max hours and shift. Say, under no circumstances will any individual work more than 60 hours a week. Limit consecutive work days, very similar to what our fire folks do. And if it's not working, maybe you relook at it and evaluate. Require minimum rest intervals. How many hours can an employee work before they have to go back to work? Rotate the high risk assignments, very similar to what our water and sanitation folks do right now. If you're on call, you're not going to be on call all week. And one thing I would say to this too is be flexible with this. If somebody was on call, we'll say that it was my Monday through Wednesday, and I had two calls on Monday and Tuesday, maybe Mackenzie's going to pick up Wednesday for me because I definitely need that rest right now. And monitor your cumulative work hours. So just keep track of them to see where your potential risk may be or may be developing. Next, plan your seasonal staffing in advance. I think a good way to look at this is go back, look at your past seasonal requirements and say, wow, we were really in a bind here because we didn't have any seasonal employees yet and we really needed them. So maybe you hire a week early. There are a lot of things you can do, but it's really just looking where we're at and what we can do forward. Last minute mandatory overtime, avoid it as much as possible. I know there are definitely things that we can't do about it, but always be very upfront and talking to people about it. Use voluntary shift swaps. If somebody knows that another individual has been working a lot of hours and they maybe have not been, see what you can do to help that. And just keep the rotation as fair as possible. Next, our supervisor responsibilities. Monitor your crew levels of fatigue. We've already really talked about how to do that, but just be very upfront with your folks and encourage that level of communication. Encourage them to adjust assignments when needed and say, hey, I just worked 16 hours yesterday. I think I'm going to do something a little less impact today. I'm not going to be able to go run this. I'm just going to work on paperwork. Lead by example. So whenever I say lead by example, talk to your team, not only about work things, but say, hey, I was having a real issue with my sleep patterns. And then I went and I talked to a sleep specialist and it helped me out a lot. So if you normalize those conversations, it's going to allow them to talk to you and maybe even seek out some of the guidance or help that they may need themselves. Lead by, and another one too is lead by example with if you know that your team has to be at work the next morning at 5 a.m., maybe don't go out with them until midnight, knowing that they're only going to be getting 4 hours of sleep. Document your scheduling decisions and always have that open to changes based on what people may need. Our employee responsibilities. So the actual people, if you think you might be subject to overtime, prioritize adequate sleep. This is one that's very personal for me. My dad is a plow truck driver for the local highway department where I'm from. And when there's a snowstorm, you very well could work an 18-hour day. And, snowstorms, they don't really care about what your actual shift hours are. So it may hit at 2 a.m., it may hit at 10 a.m. But he would look at the weather and monitor that and say, wow, the snowstorm's supposed to hit at, we'll just say 5 in the afternoon. I know I'm going to have a long night. So he would take a nap and sleep from about 10 a.m. to 3. So he had some rest, even if it was outside of the normal duties. I know a lot of times when we're responding to an emergency call or a line break, that's not applicable to us. But where it is, be cognizant of that. Also, prioritize your sleep when you're at home too. One personally for me is I do a lot of chores around my own house, and I know that I could literally be up all night, every night doing it, but I give myself a solid cutoff time. This is when I start unwinding, start making dinner, and start getting ready for bed so that I can be the best that I need to be whenever I go to my actual job. Report when you're not fit for duty. If you have something going on in your life that's going to make it hard, make sure you're saying that. Limit second job over commitment. Something that we're required for our job specifically is to disclose if we have a second job. And that's mainly to make sure that we're not overextending ourselves and putting ourselves and others in danger. Manage your caffeine and stimulant use. So the downside to caffeine is as much energy as you get, you're going to get that crash eventually too. So keep that in mind if you're just living on caffeine. Practice good sleep habits. Make it a priority in your life. Next, building our fatigue management policy. Define the maximum work hours. Establish rest requirements. Outline your emergency protocols and exactly what's to be done there. Document these procedures so people can know what to expect. I think that's a big thing too. If somebody's hired and they've been there for a month and all of a sudden they have to go work all night and they didn't know about it, they're not going to be prepared. But if they always know that that's a possibility, they can plan their lives a little better. Communicate expectations clearly and also communicate that you want to know their feedback. Next, creating a culture of rest. Normalize those fatigue discussions. Talk about it. Well, hey, Mackenzie, how did you sleep last night? How are you feeling today? Remove the stigma around reporting. I know sometimes if people would want to tease people and say, oh, they're going to sleep their lives away or things like that. Remove that. We want everybody to be well rested and feel like they can safely talk about things. Talk about the safe scheduling practices. Get input from your teams. Align your leadership message. If you're going to go out and work in your office 15 hours a day, that's not setting a very good example for your team who actually might have to go out in the field for that. So practice what you're saying to everybody. Tie rest and readiness with quality of service. You could use any of the statistics that I've given you today, but all of the facts show that working while fatigued can be very dangerous. Just like that 20 hours with no sleep is equivalent to the 0.08 blood alcohol level. Let's take all the vehicles aside. Do you want somebody showing up to work with a blood alcohol level over the legal limit? Absolutely not. So we should be preparing our actual things for that as well. Just to wrap up, fatigue is a very controllable risk factor. I will say to a certain extent, we do have circumstances that we have to prepare for and we have to address as they come up, but we can still do the best that we can to properly address those and minimize the exposures as much as possible. Overtime must be actively managed. Proper rest is going to reduce our injury, our liability, or breakdowns. Leaderships, our leaders of our districts set this tone. And safety and fiscal responsibility align with having people not showing up too tired or overworked. And it's also going to reduce burnouts. With that, I thank you all for listening to this webinar, and I'll turn it back over to Mackenzie for any questions.
All right, thank you very much, Kyle. So if you have any questions, now's the time to put them in the chat. We'll go through and read those if any come up. In the meantime, Kyle, I've got a question for you. Uh,
Absolutely.
so in your experience working with districts and dealing with, fatigue and trying to manage it, what, in your opinion, has been like the biggest roadblock in implementing these sorts of changes? Is it the administrative side of things? Is it the cultural side of things? What tends to give you the most hiccups with that sort of thing?
I would say administrative slash operations because it really does boil down to even if you are a firefighter, we'll say, for example, on your 48 shift and you have calls back to back to back, you're the ones on shift for that, and that still has to be done. Or if you're the water operator who has to respond to a broken pipe, it still regardless needs to be done. So that's something that would require extra personnel, which many times our districts simply just don't have the budgets for. So it's overcoming getting the thing done that has a very tight time limit while also being cognizant of giving our folks as much rest as possible. Because especially when we're thinking of the water side, if you're a district with only 5 people, you can only rotate a shift so much.
Okay. It looks like we do have one question in the chat. Our employees requested to move from a modified Kelly schedule to a 48-96 schedule. With that change, we found that long-term fatigue was dramatically reduced with an increase in morale, no increase in accidents or near misses. Employees are watched closely, and if needed, they will be taken offline for safety naps. Have you seen any issues with the 48-96 hour schedule specifically?
I have not seen anything specifically. Basically, the only information I've got is just from reading things and talking to some of our districts. And I know a lot of them, I won't say are switching from the 4896, but they're looking into what a lot of other fire departments across the country are doing.
Okay. And to clarify for someone who does not come from a safety background, 48 hours on, 96 hours off?
Yes, I
Okay.
thought I mentioned that earlier, but if I did, I apologize to everyone.
No worries. Okay. Well, I'm not seeing any more questions come through at the moment. So I'm going to go ahead and say that this webinar is drawing to a close. Thank you so much, everyone, for attending. If you do have any follow-up questions, you're more than welcome to reach out to us. We'll be happy to talk. Kyle's always happy to talk safety, so no issue
Absolutely.
there. Like I said, the recording will be sent out after the webinar is over, so if you missed anything, you're always able to go back and watch the whole thing again if you want. Kyle, thank you so much for joining us. Thank you for the presentation. And I hope you all have a lovely Tuesday.